Hey, Impact subscribers, welcome to the Game Changers Clinical Conversations podcast. I'm your host, Josh Kinsey, and as always, I'm excited about our conversation today. As immunization policies, reimbursement models, and practice expectations shift, staying up to date is essential to ensure patients receive timely, accessible, and high-quality vaccine care. In today's episode, we'll explore the key issues pharmacy teams should be watching now to be able to support their communities for the season ahead. It's great to have Elizabeth Skoy back with us today for this episode. Welcome back, Elizabeth.
Thanks, Josh. It's great to be here.
So for those that maybe didn't listen to your previous episode from just a few weeks ago, I'll put a plug in on it's on the OTC STI kits. So be sure to take a listen to that. But for those that maybe haven't heard that yet, they don't know you. So take a minute or two, Elizabeth, and introduce yourself and just let our listeners know a little bit about your background.
So I'm a community pharmacist, I always say first and foremost. And then also I'm a professor at North Dakota State University School of Pharmacy. I have like I said, a practicing community pharmacist where I provide a lot of immunizations. I'm one of the co-creators as well as trainers for the CE Impact Immunization Administration course for pharmacists and for pharmacy technicians. And then I've been just, as I guess looking more towards today's topic, I really been involved in the vaccine space and pharmacists' involvement and pharmacy technicians' involvement in vaccination. Even serving more recently on the adult ACIP work group for RSV vaccines. So kind of had some really wonderful experiences to represent our profession in the world of vaccination.
Yeah. So definitely when we were talking about adding this episode, Elizabeth was one of the first in my mind, and she's so graciously agreed, even though this is the start of the semester and she's super busy. So we're very grateful for your time. She has definitely been in the immunization space for years, and so we know she always has her finger on the pulse. Um, so thanks again, and let's just jump in. Let's start talking. There's a lot of stuff going on. We're getting ready for, the height of the season, the flu season, COVID, RSV, all those terrible things. I was going to say good stuff, but it's not good
Right.
stuff. None of it's good stuff. But ramping up, and pharmacies are getting ready for this. So this is, I think, a very timely episode. One of the first things I want to do is let's just touch on how let's all kind of breathe for a minute and realize how much we've evolved post-pandemic from, offering immunization services. If you can kind of speak to that from your experience and just how we kind of, we were the knight in shining armor during COVID vaccination times, and how that's really benefited pharmacy since.
Yeah, I think there's for sure since the pandemic, I think things have really blossomed, yeah, at least for the pharmacy world for the provision of immunizations. Prior to that, I think there's definitely a place where pharmacies would, provide vaccines for patients. And we always saw a lot of flu shots coming into the pharmacy, and we were really pretty great about that. But then once the pandemic came and we were really the superheroes, right, of getting the COVID vaccine into the arms of people and saving lives, that really kind of changed the way that I think America overall viewed pharmacy, not only for immunizations, but a lot of other things. And of course, we had the PrEP Act, which
Hmm.
allowed for pharmacy technicians to be able to provide vaccines. We were already kind of in that space of getting some pharmacy technicians. Some states were allowing legislation. Prior to the pandemic, kind of starting to slowly roll that out. But
Hmm.
then, of course, the PrEP Act that completely exploded, and then a lot of states were like, well, they've already been doing this, they've so let's just keep on doing this.
Continue.
Let's let our
Hmm.
legislation reflect that, and that authority to reflect that. And so not only laws, but also just I think pharmacy has just now become a place where people come for their vaccines. It's a normal standard. Where it used to be maybe the doctor's office, or the clinic, it's now the pharmacy.
Yeah. And I think it's obviously great for the profession, and I think it's obviously great for the public health, because
Right.
it's been shown time and time again that pharmacies are the most accessible of all of the kind of healthcare, entities. And so it's really easy to just walk in at any time, long hours almost every day of the week usually. And so it's really opportunistic for patients as well. So that's great. So what we really want to focus on today is talking about how you can continue with this trend as pharmacists and how we can make sure that we are staying in the public eye and being sure that we are ready for the flu season or respiratory season, I guess we should
Right,
start
right. Yeah,
calling it because
respiratory
so many
season,
things
right. Yep,
now.
yep.
So yeah. So Elizabeth, let's talk just a little bit about any sort of new um, updates or policy changes
Oh,
or anything that's happening right now that's kind of reshaping the vaccine landscape. And I know that there's a lot to talk about, so
right.
I'll let you start. Yeah.
Yeah. So there again, I mean, I think we talked a little bit. The purpose of this podcast isn't really to give everyone updates on, the actual schedule and changes and things like that. And, the immunization update is a great place for that C-Impact offers. But for us, at least, just talking about changes in policy. So as you know, and this is not, this is just factual, right? So this is not meant to at all be political or anything like that. I just want to really stress that this is just kind of, I think we all need to recognize what's happening and
Hmm.
what we're seeing in healthcare and what we're seeing, what our patients are asking questions about and what they're seeing. So as we had a new president and that then appointed a new director for Health and Human Services, and um, the director of Health and Human Services has kind of just taken a little bit of a different approach to vaccine and vaccine approval. And so for the first time, really, it was kind of unprecedented. All of the basically the volunteers, because they're not paid, so these expert volunteers that sat on the ACIP, which was the body that provided the recommendations to the CDC for a vaccine schedule and things like that, they were all abruptly dismissed, and then they were replaced by individuals, different individuals that some will argue, the argument is don't have as maybe as much experience in the space. What I'm not here to argue who has more experience or not. I will say the previous, because I worked with them, I knew them. The previous individuals had just were national experts and did just really know the space of vaccine. So once that happened, also we had some changes to the recommendations that hadn't really gone through the normal ACIP approval process.
Hmm.
And so once things like, and again, that's been unprecedented. And so we've had some organizations that for years have always endorsed the ACIP schedule, the CDC schedule, the vaccine schedule that we all follow and we look at. And so now organizations such as American Academy of Pediatrics and even including the American Pharmacists Association is a couple who have endorsed those recommendations in the past, have not actually endorsed the current vaccine schedule, primarily for at least, I think what's gotten the most attention is the COVID-19 vaccine recommendations,
Hmm.
removing the recommendation for healthy pregnant women. So ACOG has come out with a statement that disagrees with that, as well as for children 17 through 6 months, removing the recommendation for COVID-19 vaccine. And American Academy of Pediatrics also has come out and disagreed with that. And, actually hot off the press today. So again, this like turmoil, crazy, world we're living in, the AAP, American Academy of Pediatrics, just today released their own immunization schedule that they
Wow.
published. So yeah, so kind of just unprecedented times right now of, well, what schedule do you follow? How do you
Hmm.
handle this, this recommendations that are, weren't followed the right process, and how are insurance companies doing that? And how should we as pharmacists interpret that? I think it's just a really, like, I think we're going to say this a lot, just an unprecedented time, things
Unprecedented.
that
Yeah.
we've just not ever dealt with before, and we're navigating
Hmm.
through that.
Yeah. Yeah. And as Elizabeth said, this podcast is never meant to be political in any sense. It's never meant to, share any sort of views that one person has or whatnot.
Correct. Yep.
It's just matter of fact. It's sharing the
Yes. Yeah.
facts and what's happening. And so I think it's important that we are aware of that. And I think one of the biggest reasons, as you mentioned, obviously, just the general workflow and like who's going to pay and what can we give, what can't we give, whatever. But I think the biggest thing you mentioned, Elizabeth, and you hit it right on the head, is patients are asking. And
Hmm.
so we have to we can't just be like, oh, I don't know, I haven't been following it lately, or I'm not sure. So it's important that we are up to date. And unfortunately, I don't think we have a lot of answers right yet.
Right.
I
Yeah.
think we're still, muddling through that. But I think what we're here to do today is just to really point out that, again, unprecedented times, changes are happening, and you're going to have to pay attention and really focus on the changes and make sure that you're up to date, so that you can share timely and relevant information to your patients.
Right.
Um, so that's really helpful to kind of understand a little bit about that background. And one thing that you mentioned to me, as we were talking before, and you mentioned it obviously here, I didn't realize that there were some entities that were not endorsing, that had always endorsed. And so I think that's also really important just to take note of. Um, One thing we talked about before, and I'll let you kind of speak on this too, is unfortunately, a lot of our state regulation and guidance is based on specific verbiage around ACIP recommendations. So what
Right.
happens now with those kind of
Yeah.
things?
It's a really great question. And I think this is something that a lot of other healthcare providers, so again, I served on the ACIP work group for the adult RSV vaccine, and I worked with national experts and other healthcare providers across the country as we worked through data and look through data and trials and to make the best recommendations to the ACIP for RSV vaccine for adults. And working with these colleagues across the country, I will say that not other healthcare professionals who maybe operate under standard of care, they just don't really understand. Like they don't understand why a pharmacist in Massachusetts can't do this, but yet like someone else is like they'll be on a call and they're from
Hmm.
California and their pharmacist that they work
Hmm.
with can do this, and why is it so different, and why are we seeing different things across the country? And so I think just before we get into this, I think it's really important for the listeners just to know that, sometimes we have to just educate other healthcare professionals
Hmm.
about, that we operate sometimes a little bit differently depending upon our state law. So with that said, yeah, when a lot of our state laws, and not everyone, so we have some states that are operating under standard of care right now, which will just allow them the flexibility to
Hmm.
be able to provide the immunizations that is under that standard of care. However, when we have a state that states, well, any pharmacist can provide any vaccine that's been recommended by the ACIP.
Hmm.
Well, just a year ago, we were just talking about this, like just a year ago, that was a win. I mean, we were so excited when states had protocols and right, like, oh, you can provide any vaccine that is recommended by the ACIP. And then we thought, okay, we've won. Like, this is great. Pharmacists can
Hmm.
provide anything, and pharmacy technicians too, and whatever your state law is. And then now, so now what's happening is we have we have different views from different organizations on what
Hmm.
vaccine should be provided. And under the Affordable Care Act, it states that pharmacies or third-party payers have to pay for or provide vaccines to individuals that for vaccines that are recommended by the ACIP. Well, not we don't, every insurance company is probably going to interpret this a little bit different,
Hmm.
but some might say, well, I am not going to provide a vaccine to a healthy pregnant, or I will, or I should say, I should do the flip thing. Some insurance companies will say, wow, the data says that this you are at a high risk condition when you're pregnant, and therefore you should get, the data will say that you should get the COVID-19 vaccine. And so ACOG is one example. They've come out and said that that is how they feel. And so
Hmm.
you might have an OBGYN who's like, okay, go get your COVID vaccine to that healthy adult or pregnant woman. And then all of a sudden they go to their pharmacy and their insurance company will cover it because they're like, yep, it's going to prevent, like, yep, we're going to cover
Hmm.
that, even though it's not, with ACIP recommendations. You have a lot of insurance companies that are still covering. And then the pharmacist like, well, I can't actually
I
give
can't give
that
it
to you
anymore. Hmm.
because
Hmm.
my state law says only things that are recommended by ACIP,
Right.
and this one is no longer recommended for you. And
Right.
so, what do you do? And so
Hmm.
I think that's where we're going to see some of this just uncertainty with things that
Yeah.
we thought was fine. And now all of a sudden we're like, well, what do we do? And how do we handle that?
Yeah. And I think one thing, and obviously this we are also not telling you exactly how to practice or what you should do
Right. Yeah.
because Elizabeth and I, we're knowledgeable in a lot of things, but I don't know that we know all 50 states
Right. Yes.
protocol for vaccination
100%.
administration. But one thing that you could look at doing, if you feel like your hands are a little tied, if how you were administering previously was under protocol, maybe, as long as you get a prescription from the
Right.
doctor. And so therefore you have a specific prescription for that specific patient, then that is a little bit more of documentation that protects you and so forth. You're not operating, specifically under the protocol anymore. You're specifically under a prescription. You're filling a prescription. So that's one way potentially
Hmm.
around things.
Yep.
But again, we fought so hard to get past that because that was what, we didn't want anymore was the restrictions of having to wait for a specific prescription every time. We wanted people to walk in and be like, I'm supposed to get this. I need it. I
Yes.
want it,
Right.
whatever. But in these, as we've said before, unprecedented times, that may just be how we have to, kind of proceed for a little bit. Um, and Elizabeth, I think, hit it on the head earlier too, again, with another statement where she was like, this was a win a year ago, and it's not a win anymore,
Right.
So I think that really focuses on what should we be advocating for in our states and what verbiage and changes now need to happen, and a lot of states are embracing that standard of care model, which removes a lot of those restrictions. So that's a whole nother episode. We could get into all of that, but
Right.
let's
Right.
stay focused on preparing for the respiratory virus season. So
Sure.
so again, I think as Elizabeth has said, just to kind of summarize, um, we are going through some changes. There aren't a lot of answers right now, but what you need to know for sure as a pharmacist is you need to tread lightly, be careful, make sure that you're still following the letter of the law in whatever state you're practicing, and making sure that you're making right decisions. Because, not to second guess yourself, but on a lot of these things over the next few weeks and this season, you might have to second guess and just be like, oh, am I still allowed to do that? Should I still be doing that? Do I need to get a prescription? Whatever. So just be mindful of those things. Let's talk a little bit about um, Elizabeth, if we can jump into some of the opportunities for us as pharmacists. I know we've kind of laid the groundwork for doom and gloom for this season, but let's talk about we still have plenty of opportunities. We
Oh,
still
100%.
are
Yes.
a great option for patients to get vaccinated. So let's talk a little bit about some of the changes in reimbursement and just making sure that we're taking care of that revenue for ourselves, but also increasing vaccine uptake as well.
Yeah. So, I mean, we're talking about if we focus on respiratory season, probably um, I guess leeway, or I should say the ambiguity or the gray area will probably be with the COVID-19 vaccine.
Right.
However, influenza is still recommended, for, 6 months and older. And then as well as we have the recommendations for RSV that have been expanded and,
Hmm.
again, making sure you're up to date on those. So those really haven't changed. And if you look at least for pharmacy and like reimbursement and things like that. And if you look at even, again, an opportunity is, the RSV vaccine is a Medicare Part D vaccine. It's covered under Medicare Part D, which is, the pharmacy benefit. And so uh, those that vaccine, at least for adults, like typically can't be geared for 65 and older, I should say, won't be covered under other
Anywhere
insurance.
else.
And
Hmm.
yeah, exactly. And so, when you have someone 65 and older, they're going to be going to the pharmacy. And so that's like an opportunity for us because that's who we're going to be having those conversations with.
Hmm.
And then also, again, more of that ambiguity is going to be more with that COVID-19 vaccine, or particularly if you're immunizing individuals less than 18 years old, so 17 under, and then of course, healthy pregnant women. And so I think where those recommendations have kind of changed. And so I think what we'll just want to reiterate is that for opportunities is just in making sure you're still getting, as you mentioned, Josh, like still getting reimbursed and things like that. And I would just reach out to your main providers, like the third party benefit managers or the third party, payers that you typically will work with in your pharmacy,
Hmm.
and ask what they're covering. Just
Hmm.
make sure that what they got, are they, what recommendations are they following? Are they following
Right.
the AAP? Are they following the ACIP? Are they following the ACOG and all that? We had talked a little bit earlier too about, well, could you do a test claim? And yeah, you could, definitely, and that's one way to do it. But yet we've also heard a lot of stories from pharmacies who goes through, on the front end, and then all of a sudden they get a kickback
Hmm.
later, that, where the patient either gets charged, the pharmacy gets charged for that, and
Yeah.
where it's not paid. And so you don't want that either. So I would just say if you're kind of offering vaccines to that gray area where there's conflicting recommendations out there, just to make sure that you are getting paid. And one of the best ways is just to contact some of those main providers and figure that out. So
Yeah, that's great
yeah.
advice. And I think it's important to make sure that, I'm a very process-oriented person, so I think it's important to also make sure that you've got the steps down right. So before you're investing in a lot of supply and, filling up your fridge and freezer with vaccines, you want to be sure that what you're carrying is going to be covered. So I think that's a good first step, is to just, sit down and it may take some time, but it could be a project for another member of your team, to reach out to those third party payers and just determine, like you said, simple as, what guidelines are you following? What are you going to be paying for, so that you can make sure that you can get reimbursed for those services.
Right.
Um, I love the call out to the fact of reiterating and driving home the point that the RSV vaccine for 65 and older is a Medicare Part D. So that again, they can only get that in the pharmacy. So you are the winner there. So another opportunity to really promote that service and to get more vaccines in the arms of our patients. Was there anything else in that space that you wanted to touch on, Elizabeth? I feel like I may have
um
cut you off. I'm sorry.
No, I don't think so. I think, looking even just at, just maybe expanding a little bit more on opportunities in general, is kind of these, few weeks before, respiratory season like really hits, or, that we're
Hmm.
really busy. This is a really great time just to ensure that your screening checklists are up to date, and
Hmm.
that again your inventory, as you mentioned, or even that your emergency kit
Yep.
is refreshed and everything's in date there, and making sure that the pharmacy knows the workflow, and how are you going to handle if you provide a lot of vaccines during this season of that September, October, November timeframe, how you're going to adjust workflow, and some of
Hmm.
those things. So I think um, that's one thing just to keep in mind, for an opportunity for pharmacies just to take this time and to get prepared. Um, the other thing is just to understand. I think like that's what the purpose of this podcast is, right? So understanding kind of what's happening right now, and when
Hmm.
a patient comes to you, why they might have those questions. So
Hmm.
understanding if someone comes to you and they're like, well, my insurance cover this, that's why they're asking the question, right? These differences in interpreting of the recommendations, or
Hmm.
even my pediatrician recommended this for my child, but I've heard the CDC
Right.
doesn't. Like, what? Why? And you're my trusted. There's these conflicting. I'm going to you because I trust you more than anybody. How many times have we heard that, right? I trust
Hmm.
you more than anyone. Any other
Hmm.
healthcare professional. So being able to have that conversation with them, and
Yep.
helping them make the recommendation that's best for them. So I think
Yeah.
those are all just things right now to be aware of and to be prepared for.
That's great. I love the call out on, using these next few weeks before the season really hits to kind of prepare. And, we all know we're not gonna, tread on it lightly. Like it's hard on workflow sometimes. And so, even with the additional expanded responsibilities and roles of pharmacy technicians to administer, it still sometimes takes a toll on workflow when you're taking, even, when you're taking a tech or a pharmacist out of workflow. And so, like you said, just kind of adjusting for that, trying to figure out different ways in which you can accommodate those adjustments so that you can continue to give the vaccinations to patients when they're asking for them. So
Yeah.
that's great. And good call out as well on making sure emergency kit is up to date, making sure that those things, nothing's expired and you have everything that you need in there. Those are few and far between types of
Mhm.
occurrences, but it's always something that when it does happen, you want to be sure that you are prepared for it. So,
And
um,
also just a good time to make sure your staff is all aware of your policies
the
and
changes.
procedures, right?
Yeah,
Yeah, making
yeah.
sure they're aware of the changes.
Hmm.
Always a good time to refresh that needle stick injury, refresh skill. I
Yep,
mean, that's actually like a recommendation that should have a little quick refresher. And even
yep.
though you provide a lot of immunizations, like let's refresh, like, safety needles, use the safety needles we're using. I mean, whatever that might be, it's just a great time just
Yeah.
to and document that in your policies and procedures that you've done it.
Absolutely.
Yeah.
That's a great call out too. It could be that, your wholesaler is supplying a different safety needle this year to
Hmm.
you, or the one you previously used is too expensive now, and so you've changed. And yeah, it's really important to make sure that everybody on the team is aware of how those work, practice with one, making sure that sharps containers are, not overflowing and ready for the season so they can be filled up again. So yeah, it's a great time to just kind of do a little housekeeping and making sure that everybody is ready. Um, One thing we talked about, I want to spend just a couple minutes on, Elizabeth, is we talked about how, um, unfortunately, all the verbiage and things that we used to say and advocate for and get bills passed and everything, that may need to change a little bit. We may need to refocus, and maybe everybody does need to get on the standard of care model bandwagon. So can you speak to anything like that? I know that a lot of our listeners are super involved and do want to make sure that they're advocating for the right things. So any kind of guidance you can offer there would be great.
Yeah, at least for me personally, I feel like the last, few months have just reiterated a new problem, right?
Hmm.
Like we talked about this a little bit before, but we thought we had a solution, and then
Hmm.
all of a sudden now we're met with a problem with that solution. How many times has that happened in life, right?
Yeah.
Where you think you have it figured out, and then it's like, whoops, I never expected that coming.
Well, I
And
mean, and why should we? Because
yeah,
ACIP was the gold standard for,
right, right,
years and years and years, even if not decades. And so
right.
we thought that if that verbiage was in there, then, we were golden. So,
Right.
yeah.
Yeah, it even covered, like when the ACIP recommended something, even covered like the emergency use
Hmm.
authorizations and things like that.
Yep.
Yeah. So, but I think it's just more or less of just having that conversation of if something's not working for you in your state right now, uh, it, call the right people. Like call your board, call your pharmacy association, call your
Hmm.
college, like whoever it is that is your advocate. Maybe it's a legislator that's in your district, whoever that is. Making sure that they're just aware of the challenge that you're facing. So if you are
Hmm.
not able to provide care for whatever reason at the level that you want to be able to provide it because of some law or some statute or some regulation, this would be just a really good time to give
Yep.
those examples of
Hmm.
what's happening and why it's happening and how and what would be a better model for
Hmm.
you and your state and your workforce.
Yeah.
So
And we don't, I'm talking to the listener, you don't need to have the answer per se. It just
right.
needs to be that you're, bringing up the question, bringing up the point. I can tell you right now, I know for a fact state associations are actively preparing what it is they want to push through in the next cycle of things. And so this is a great time to really get, your ideas and your vision out there as well. And it's really important that we have a lot of input because everybody practices in a different region and you have a different type of patient population and your community needs are different. And so I think it's really important that, and we preach this all the time, don't just sit back and say, well, I'm just one person. I can't really, it doesn't matter if I don't get involved, somebody else will handle it. But I think it's really important that we all take a chance at speaking out because it's important to make sure that our communities and our patients are represented. So,
Yeah.
um, okay, so we pretty much touched on some of the challenges, and we've hopefully given some strategies for overcoming those barriers. So we've talked about navigating that payer variability and making sure that we're um, touching base with some payers up front to make sure of what they're following, what they're covering, what they're paying for. And I think it goes without saying. I think I've said this 1,000 times on the podcast in some format. Whatever is happening, document, right? Like it's super important to make sure that you're documenting everything. And then also adapting to those changes in vaccine recommendations. Um, we've talked about how today, unfortunately, we don't really have a lot of answers. So what we're challenging you to do is to remain updated. Like you're going to have to stay focused, and you're going to have to come back and listen to the updates and make sure that you're on the right page so that you can provide the best care and answer all the questions from your patients. And then the last thing I want to talk about, just because it's always good to address, is overcoming either barriers to vaccine access through, equity or other issues, and then just hesitancy in general. I think,
Mm.
unfortunately, I think we're going to see a lot of people latch on to some of these changes right now and saying that it's going to increase the hesitancy of receiving some vaccines, I think. That's my opinion. But, you always have some great insight as to how we can overcome some of those hesitancy or vaccine uptake challenges. So I'll let you speak on those for a few minutes.
Yeah, so I think, nationally we've seen a decline in vaccination rates. And I think one thing we could probably even speak to if we're trying to talk with our patients or advocating for vaccination is kind of what we're seeing, right? So, I
Hmm.
mean, talking about what we're seeing with measles across the
Yep.
country
Yep.
and what we're seeing. I mean, last year's influenza season was horrendous, and look at the
Mhm.
vaccination rates for influenza. I mean, so we're seeing that, what's happening, and then we're seeing the results of that. And so,
Mhm.
the results of decrease in vaccination rates. And so um I think that's a really great, good opportunity for patients when you're just, advocating or talking about vaccination, and making those recommendations. I also think that, if you're vaccinating a certain population, maybe it's the children, or maybe it's, pregnant women and with COVID-19 vaccine, and you have providers, or you yourself, that the insurance companies are paying for it, and you're wanting to recommend those to those patients, understanding the science behind that. And both AP and ACOG have done really great publications and, statements as the science behind why these patients and these populations should be
Mhm.
vaccinated.
Mhm.
And so just kind of just making sure you're educated and you're able to speak to that. And then, of course, it's okay to not always have the answers. I mean, I think
Mhm.
it's just remembering that it's okay to listen to patients. Well, of course it's okay to listen to patients. We always want to listen to patients, but, making sure that we're listening to their concerns. And then if
Sure.
they're asking you a question and you don't know the answer, that's okay. Because I mean, I'm in this space a lot, and I still get asked questions that I'm like, wow, I have never heard of that before, especially with
Mhm.
social media and misinformation. And it is
Mhm.
okay to say, you know what, I really care about you, and I'm going to take some time to make sure I'm answering your question adequately. I don't think that that's correct. However, I'm going to take some time. Would you mind if I get back to you? Or, so I
Mhm.
think just remembering everyone that it's okay to do that. Um, and then, if you are unable to provide a vaccine for a patient because of, what's happening right now, and a patient desires a vaccine for that access, just ensuring that you know where they can get the vaccine or how they can get the vaccine. So you mentioned, like, whether that's with a prescription to you at the pharmacy that you can provide, or whether that's, through another healthcare provider, or,
Mhm.
referral, or maybe it's a public health unit or clinic that has it, or whatever that might be. Just making sure that you kind of know where to send a patient if
Yeah.
they're wanting a vaccine that you can't unfortunately provide due to your state regulations right now.
Yeah, because ultimately, I mean, we're we're just wanting vaccine uptake in the community, right? Yes, it'd
Mhm.
be great if it was through our pharmacy services and through pharmacy in general. But yeah, you bring up a great point. Like it's important to make sure that we are promoting access to vaccines, regardless of whether or not it's something that we're able to offer. Because as healthcare professionals, we understand the importance of vaccine uptake. So yeah, that's great. Okay, well, I think we've touched on everything that I had on my list. Was there anything that I missed, Elizabeth, that you wanted to be sure we talked about?
No, I don't think so. I mean, I think I would just kind of reiterate, just again, that checking in with your own community and your own state, right? Checking in with your state
Hmm.
association, your state board of pharmacy, knowing how to handle these situations, for the pharmacists and the technicians, staying up to date with your own Department of Health within your state,
Hmm.
to keeping track of rates and what's happening. And they're usually really good about providing updates from the federal level as well. So I would just say, that's just my last plug as we're going into the season, is just taking a few moments just to refresh, and maybe instead of scrolling on your phone, looking at social media or whatever, you scroll and just do a quick update on your Department of Health or
Yeah,
your state association or your board of pharmacy or
yeah.
whatnot. So
Great
yeah,
advice. We all have 5 or 10 minutes we can take away from social media scrolling to do other
right,
things. So yeah.
right.
Yeah, well, one thing that I wanted to mention really quick, Elizabeth mentioned it earlier, and I do want to reiterate. She mentioned that there is an annual immunization update that we offer. It is currently in the catalog as an on-demand course. So be sure that if you were unable to attend the webinars that happened in mid-August, the live webinars, be sure that you're listening to the on-demand version of that annual immunization update. It goes into a lot more of the new vaccines that are on the market, how they differ from current vaccines, talking about schedules and working through some case studies to kind of help with those informed decisions that you're helping your patients make. So super great information. So be sure you check out that on-demand course as well. So last question to you, Elizabeth. What do you think the game changer is here? We always like to wrap it up. It's the Game Changers
Yeah,
podcast.
I
So
think yeah,
what's the game changer?
I think the game changer is we're just in a time right now of just uncertainty, and we're in it.
Hmm.
And so just the game changer for us is just making sure that we're staying up to date, that we're
Yep.
listening, we're leaning in, we're advocating where we need to advocate, for our own profession, and
Hmm.
allowing us to take care of our patients.
Yep.
And also, yeah, just knowing that there is uncertainty, and it's okay to, if you're feeling uncertain right now, that's okay. Like that's
Hmm.
a lot of people all the way up to the very top are feeling uncertain in how things are being handled. And so just ask questions, be curious, and find those
Stay
resources
informed.
that you need. Yep, stay
Hmm.
informed.
Yep.
Exactly.
That's great. Well, thanks again, Elizabeth. It's always a pleasure. I appreciate you giving your time to us today.
Absolutely. Good luck with respiratory season coming up.
Yes, everyone. Yes.
Yeah.
Get out there, get those shots in arms. We need them. If you're a CE Plan subscriber, be sure to claim your CE credit for the episode of Game Changers by logging in at ceimpact.com. And as always, have a great week and keep learning. I can't wait to dig into another game changing topic with you all next week.